We're live, Chairman.
Thank you very much. Good morning, everybody. Welcome to this meeting of the Overview and Scrutiny Committee, Friday, 9th of October. Short announcement about how we will be covering the attendance at this meeting. Due to the coronavirus pandemic, the Council will be holding this meeting electronically in accordance with the relevant regulations. Members of the public may also attend this meeting in an electronic capacity, and there is a link on the Council's website for them to do so. Members of the committee are asked to keep their microphones and cameras switched off until called upon to speak, and to switch their microphones and cameras off once they have finished speaking. To indicate a desire to speak, members should request to do so using the public chat function, and at appropriate times I will ask members to vote for, against or abstain for each item at the end of the debate on that item, and ask that members indicate their vote using the public chat function. I will declare the result after each vote. Officers are in attendance but will keep their cameras and microphones switched off unless called upon to speak. I would like to remind members that the reports they have in front of them today cover the key areas they requested and prioritised at the last joint meeting of this committee, together with the Health Scrutiny Committee. There is a lot of information to consider, and the reports cover a wide range of areas because that's what we, as a committee, have requested. After a period of number of months of business to catch up on, I beg your pardon. After a period of time where our meetings were suspended during the early stages of the lockdown, we have a number of months worth of business to catch up upon and gain a view on. It's worth noting that all the information we receive as a committee will inform our thinking around the work programme and priorities as we continue to move forward. Thank you for your patience on that. Now, membership changes. Margaret Eames-Patterson is here substituting today for Lynn Chesterman for this meeting only. Margaret, welcome. Yes, I can see you're there. Thank you very much for joining us today. We have no apologies. So can I ask for a declaration of members' interest? Do any members have any pecuniary interests to declare? I'm taking that as a no. Thank you very much. Moving on then, we have a number of minutes to agree at this meeting, some of having been passed over previously. So would you join me in agreeing the minutes of Wednesday the 22nd and Thursday the 30th of January 2020, which was our IP meetings? Again, in the chat box, if you would. Nigel, you wish to comment?
Yes, thank you, Chair. Yeah, no, it's just I raised this pre the meeting in correspondence with officers and I think yourself. The IP minutes include a whole long list of recommendations to Cabinet.
Yep. And
I'm curious. I'm fairly new to this process, and I don't see a mechanism by which those are followed up. I know I got an answer from officers saying that once the budget is set, that's the end of the matter. But most of those recommendations don't actually relate to the budget itself. They relate to things that we might ought to think about doing differently. So I do think that ought to be something that this committee thinks about in the future as to how those are better tracked.
Yeah, good point, and expressed exceedingly succinctly, for which I thank you. Yeah, point taken. We will, officers are aware, as you know, and we will take that up in future. But the minutes have been, yeah, as you say, the business has now been accepted elsewhere. Thank you for that. Any other comments before we tot up the...
Chairman, I have a comment on the minutes.
On these minutes, Ian?
The January ones. Yeah.
The January ones, yes. Sorry, I thought your comment was elsewhere. Please do, far away.
Paragraph 2.1,
yeah.
I'm attributed interests which I don't have.
Yeah.
It's the I'm not a chairman of SECRA and I'm not a governor of the Chesbrook Management Committee, but the first sentence of paragraph 2.1 is correct.
So if we remove all after, he receives an allowance from the board, full stop.
Yeah, the next two sentences are not correct.
Okay, noted. Thank you. Officers will make the appropriate changes. Thank you very much. Any other comments? This is specifically the two January meetings. Nope. Teresa, are we getting the appropriate level of consent? Could I just remind you, please show your agreement or otherwise in the chat column to the acceptance of the minutes of the meetings of the 22nd and the 30th of January this year. Thank you. They're coming in. They're coming in slowly. We should be about there now, Teresa. Thank you, officer colleagues. Are we there? I think we are. Minutes agreed. Thank you, Teresa. Super. Then if we can move on to the minutes of the special overview and scrutiny held on the 11th of March 2020. Again, meetings, the minutes of which are on Modern Gov. Firstly, any comments?
If I may, Chair, just a very brief comment, and that is that I can't recall, but I think we did ask at one of the previous, maybe the last meeting, what the updated status of those homes, those respite care homes was, because I think they've been given a stay of execution. It'd be nice to know what's happening with that moving forward.
Yeah, absolutely. Couldn't agree more. We're always keen to do that, but do you accept that the minute is accurate?
Absolutely.
Super. Thank you very much. I don't know if it's me. I seem to have a very slow chat column today. Teresa, I'm getting lots of agreeds on that one. Are you content that we have passed the mark? I don't want to spend too much more time on this because we've got a very, very full meeting. Are we there, Teresa? Thank you. Excellent. Right. Moving on then to the joint meetings of the OSC held on, of the OSC and HSC held on the 16th of July and the 11th of August. Firstly, a plea if there's any comments, please. I take silence as acceptance on that. Again, if you would, in the normal way, consent in the column. Thank you. Thank you, colleagues. Okay, that's all agreed. Excellent. Thank you very much for that. Took a little longer than perhaps it might have done, but no bad thing. Excellent. We move on now then to item 2 of the substantive business of this morning, which is a report from Adult Care Services. We have Chris Badger, I hope, waiting in the wings. Are you there, Chris?
Yes, David, yes.
Excellent. Thank you very much. And you also have with you, I think, is Tom there? I'm not sure if Tom is going to be contributing with you or for you or after you, but is Tom also there?
David, thank you.
Excellent. Good. Chris, we've allowed 10 minutes for the presentation, no slides, with an opportunity thereafter for some questions. And I hope you've steeled yourself, because I think there will be quite a lot of questions on this topic. So please, Chris, away you go.
Thank you, David. What I proposed is probably really to assume that the report has been read. I'll just go through a couple of highlights rather than taking the whole 10 minutes up, David. Is that agreeable?
Well, we're perfectly happy with that. Yes, the report,
okay.
We've got the excellent report, so that's not a problem.
So really what we've tried to do is a number of things that the committee asked for, as well as some more general updates on the ACS position. Clearly, it's a dynamic position as we move through into winter and the potential for a second wave, second peak. This then focuses on what we did in response to the pandemic in the first wave, and also elements around recovery and how we've changed services both to recover from that peak and also to prepare for a potential second and a clearly going to be challenging winter. Just to break it down, really the objectives in adult care have been twofold. One has been managing the impact of the disease itself, and particularly that relates to managing infection control in care homes, securing support to the NHS to ensure it can deliver care to those that were suffering with COVID, and also a significant level of support for those that were impacted by the lockdown. And overall, we know that more people in a sense were impacted by the lockdown than were by the disease itself. And in both cases, clearly adults with needs, either social care needs or needs relating to the fact that they were left isolated and without as much support as they would normally have, required us for different levels of degree to be involved to support them. I've taken through some examples of the services that have changed as a result. So our safeguarding service saw a significant reduction in safeguarding referrals during the period. Now, we don't think that's because there was less issues taking place, but just that actually the level of reporting would have been a lot lower than we would expect, but partly because, for example, care homes were closed or people maybe reduced the amount of care they were receiving at home. We've seen that reduce in terms of, increase again and bounce back, as you've seen in the graph that's presented in section 4. Similarly, with our overall assessment activity, we saw a bit of a dip off during the early stages of the lockdown as people, to an extent, retrenched back and were shielding more and were less willing to see professionals as well, because they're worried about infection control risks. So we developed very quickly ways of working with people over the telephone and over video. Again, we're beginning to see quite significant increases in referral activity, particular concern around the support to carers, informal carers, unpaid carers, family carers that have clearly had to undertake significant care and responsibilities during the early stages and latter stages of the pandemic. So that's outlined in 5. So those graphs in 5 that you see very much show where our referral patterns and activity numbers had got to. We talk also there about the support that we received from the voluntary sector. I think it's important to place on record how valuable that was. Examples there around the Age UK and what they've done around support for people, Carers in Hearts, with keeping carers in touch with other people and support to them. And of course, Hertfordshire Independent Living Service and Meals on Wheels. We played an important role in adult care services in Operation Shield and Operation Sustain, massive mobilisations of effort across the voluntary sector and statutory agencies to support those who were shielding or through the lockdown weren't able to access support for themselves as they normally would. And I'm extremely proud of the efforts of both council teams and our voluntary sector and other public sector partners in doing that. Section 6 talks about domestic abuse and the work we did to support victims of domestic abuse and work wherever we could to prevent instances of domestic abuse rising. We knew that was a risk in lockdown, and Helen Gledhill, who leads on that for us, is here too to answer any questions that you may have on that. I just wanted to talk about 2 key care types, and then I'll finish. One was clearly care homes. So we know that care homes were one of the sort of epicenters of the pandemic. We saw our outbreak in care homes, in Hertfordshire care homes, probably start earlier than other areas, but likewise finished earlier. This we believe was down to our proximity to London, and therefore we saw greater rates of care home outbreaks and sadly fatalities in those areas nearer to London, because there was a greater prevalence of the disease in London at the time. By the end of the pandemic, our position around the mortality rate in care homes and the outbreak level was actually pretty much exactly on the national mean, the national average for what other areas experience. So we weren't an outlier in terms of our impact on care homes, but it still took a very profound effect on the care home sector. I was pleased with the multi-agency response that was put in place to help manage and prevent further outbreaks, including colleagues from the NHS and social care. That continues to meet, I think, on a daily basis to help try to control, monitor and manage outbreaks in care home settings. Finally, on home care, we saw an initial dip in our demand for home care as people were reluctant to have others visiting their house. That's picked up again, and underpinning the care home and the home care markets, as well as other care markets, has been a very significant financial support package that we've put in, both to fund things like PPE for care providers, personal protective equipment, but also fund the additional staffing costs that are associated with things such as isolation periods, further staff sickness, and so forth, and also some of the issues around childcare that relate to the schools being shut. So I've given hopefully a bit of an overview there, but obviously here to take specific questions. Thank you.
Yeah, thanks very much. That was very useful, Chris. Thank you. Given that you've not taken up all the time, I'm going to just quickly ask Tom and Helen if they want to add to anything. Tom, do you wish to put anything in at this stage?
Thanks, David. I think Chris has given a very useful, broad overview. Sorry, I don't need my camera on. I think in terms of care homes, Chris is absolutely right that the care home sector were right at the front line of this pandemic. And the only thing I wanted to really raise that Chris didn't pick up on was that whilst it was a significant impact, both on clearly on the residents, their families, but also the staff. And I really want to just take a point to praise care home staff, many of whom are relatively low paid, but the support and the quality of work they've done in order to support and care for the emotional as well as the physical needs of residents in care homes has been absolutely tremendous. Chris also pointed out a real positive for Hertfordshire's health and social care partners, the way that we came together, largely led by the local authority, but significant input from health, I think ended up saving lives. And we really managed to get hold of the right processes and actions in place in order to support care homes. And for that reason alone, whilst there is some natural feeling of trepidation as we are at the very start of the second peak, we're in that peak, that's what Public Health are informing us now. Certainly the rates of transmission of the disease are higher than they were during phase one, but you need to look at the number of people that are in hospital and the death rate, which is still really low compared to what we would have expected in phase one. And I think that's a testament to the learning that we've managed to go through over phase one. We've got systems in place, we've got reporting in place, we've got support from professionals across health and social care. And so I think we are in a stronger position than what we were during phase one. But that's not to say that it's going to be an easy few months for us. That's all I want to say.
Excellent. Thank you very much. Helen, I don't want to put you on the spot, but if there's anything you would like to add, this is your opportunity so to do if you wish.
Thank you very much, David. Yeah, I mean, I think I'm conscious of time, but I'm very happy to take questions from panel members as we go forward. But I think the report just highlighted nationally that there was a significant increase in relation to calls to national helplines and the kind of demand for support for people, because we were all made very aware about the the additional pressures that lockdown puts on victims of domestic abuse. And so in Hertfordshire, as the report says, we brought together this emergency response to respond to that, because in Hertfordshire we actually saw a decrease, which was more concerning really. So it was very much about getting the message out that all our support services were available for people. And as a result, over the last 6 months, we have seen those calls and referrals come back through to our services, and I'm happy to take any questions that people may have about that specifically.
Thank you very much. And at this point, I would hope I'm not alone. I'm sure I'm not. I'm sure the committee would want to associate itself with the comments variously made by Chris and Tom and Helen around the wonderful work that the volunteer sector has stepped up at short notice to undertake. A huge percentage increase in their normal base workload, and of course we all support in every way we can care homes, and in particular those carers out there in the community that are doing such a wonderful job. So thank you very much for that. I've got indication of a number of questioners. I've got Nigel at the moment. I have Nigel, Sandy and Margaret. So Nigel, would you please set us off?
Thanks very much, Chair, and thank you, Chris and Tom and Helen. Fantastic report, very, very informative, very well written. So please pass back our appreciation for that for whoever wrote it. And also, I think what it details is a vast catalogue of things that have been done very well, and it's actually really quite inspiring to read just how people have reacted to the crisis. I think we did do a good job on the whole, and I think particularly in the care home sector, bringing that under control in March and April, clearly, it was a massive impact, and I think we still need to look at perhaps exactly how it came about, but I think the fact that we were able to control that was very, very good. I wonder if Chris could or Tom could possibly give us an update on where we are now, particularly as we do see a lot of headlines saying we're back where we were. I would take issue a little bit with what Tom said about the rates of infection, because I mean what tends to be missed by a huge number of commentators is that the curve from the early part of this year was so underestimated because it relied on testing data, which wasn't there. I mean, the overall number of people infected in the first wave was probably in excess of 5 million. We're now looking at probably, and at any one time, maybe up to 2 million. And yet now we're probably in the ballpark of about 1/10 of that across the country, most of which, of course, is actually in the north rather than in Hertfordshire. So I think we do need to make sure we do keep that in perspective when we're talking about where we are now. But I think the key point I wanted to ask was the role of testing in care homes and of care home staff, which I believe has changed significantly.
Thanks very much, Nigel. You set the scene for us wonderfully there, but I regret that we probably won't be able to have that level of detail as we go forward because of the time constraints. So a quicker lead into questions, please, if you could possibly do so. Who's going to take that up? Tom, care homes?
Yeah, I'm happy to start, and I'm sure Chris will come in. Your point, Nigel, is absolutely well made. The reasons why we've got significantly more numbers of people who are testing positive is because we're doing significantly more testing, and 70% of the people that are testing positive are asymptomatic. So in phase one, these people would have been going about their day-to-day duties, going to work, going into schools, going into care homes, and unwittingly transmitting the disease. And you're right to pull me up on that. It's absolutely valid. The point I unhelpfully was trying to make was around how that translates into symptomatic cases and the impact that then has on primary and secondary care. So people going into hospitals, yes, needing ventilation, and needing that treatment. We are not seeing the same level of uptake of beds in hospitals that we did in phase one, because we're on it more. Yes. And I think that is a testament to, it might be late in the day, but we are much more on it in terms of trying to get underneath that particular regard. In terms of testing, sometimes it takes a while for us to catch up with what is proposed from the Department of Health to actually comes into reality. It was delayed, the regularity of testing, but we are now testing staff in care homes every week and residents every 28 days. I know that there's been a lot in local press and national press around the efficiency of getting the results, and that is all to do with lab capacity. So whilst the testing kits are being made much more widely available, the lab capacity is still trying to catch up. We know that the government are investing heavily in lab capacity, but there's a lag for us to do that. In other areas, not in Hertfordshire, but in other areas, the acutes have their own lab capacity to do testing. The two main hospitals in Hertfordshire are still trying to look and build on that capacity, so we're not there yet. But this is as Chris said right at the outset, it's a very dynamic situation. It's something that's moving each week.
Yeah. Thank you, Tom.
Thanks, Tom. Anybody would Chris or Helen like to add anything to that? I suspect not. Very comprehensive response. Thanks very much. Okay, right. Over then to Sandy, but I've got, just to remind you, I've got Margaret, then I have Ken, and then I have Francis. But Sandy, the floor is yours.
Yeah, well, I mean, don't worry, I'm not going to make a very long meal of it. Can I just echo what Nigel said about what an excellent report? And obviously it was a hideous beginning. I mean, just one home in my division, half as many people died as in the whole of New Zealand so far. But, you know, we do feel like we're on top of it. I've just got two quick questions. One is, I mean, a very generous tribute to the voluntary and community sector, but clearly they are facing significant financial issues because their normal fundraising has been completely disrupted. And I just wondered if there is any sense or way that we as local members should be alerted if there is a particular, I mean, obviously I hope that I try to be in touch as much as possible with my local charitable groups, but if there's a particular issue with one group or whatever, if we can be alerted in case we can in any way help think about sources of funding. That was one question. And a second question, I'm sure other colleagues as well, I continue to be lobbied about family members where the resident has dementia and they are really increasingly anxious that they're not able to visit, and they feel that this is very, very bad for their relative who simply has no idea what's going on, and often the only kind of contact with reality they have is meeting and seeing a known and remembered family member. And I appreciate the prime need is to stop COVID reasserting itself in homes, but I wonder if there's a way of somehow squaring that circle.
Thanks, Sandy. Who would like to pick that one up? Is it again another one for you, Tom, I guess?
I'll take the first one and then Tom can do the second one.
Thank
you. On the voluntary sector, Sandy, yes, clearly a number of voluntary sector organisations clearly suffered a loss of income. We are able to support some voluntary sector organisations that are delivering some services for us where that's difficult to maintain because of infection control, the need to be COVID secure. We've offered a number of those organisations the opportunity to receive the funding they had pre-COVID in terms of number of, based on what their number of service users, etc., was before COVID. We've offered to continue that funding to support their cash flow and so forth. Clearly, we're looking at other proposals around what other bits of support we could get for voluntary sector organisations, and I know there's been a number of national funds. I think the point's well made about sharing intelligence around organisations that may be struggling and making sure local members are aware, because clearly we need to understand that if you look at the course of a 5 to 10 year period around a voluntary sector organisation, whatever happens with COVID, it will either get over it completely or we'll learn to live with it in a different way. So what we don't want to do is lose voluntary sector capacity because of a 1 to 2 year issue which has affected cash flow and stuff, and then we lose that capacity and that knowledge forever. So clearly I think that I'll take an action to talk to my colleagues that lead on this for me around how we're working on kind of surveillance around that, and that we're sharing that with individuals that may be helpful in the locality. I think that's a point well made, and I'll take that up with them. Tom, on care homes, you want to just on the visiting issue?
Yeah, thanks, Chris. And Sandy, I think it's absolutely the right question to raise around visiting. I don't know whether, Margaret, you also wanted to pick up on visiting as well. During phase 1, clearly, our primary goal was to work very much with Public Health Hertfordshire, who have been absolutely tremendous in supporting the work we're doing around care homes, but also working with the 2 clinical commissioning groups, the NHS clinical commissioning groups, the acutes. We work with Hertfordshire Care Providers Association, GPs have been involved, all trying to work towards the same goal of how do we protect residents in these care homes. So a lot of that is around infection control, and that was largely right from the start and backed up by national guidance as well about limiting people visiting care homes. And I think we did that quite successfully. There was some challenge back from care homes who weren't impacted by the infections. Not all care homes had COVID in their homes, and they still wanted to allow visitors to come in. But there was a very clear message that we wanted to limit and restrict the chance of the infection coming into care homes. However, you're quite right, Sandy, that there are some people who could be in the last stages of their life with dementia, not really clear, not able to understand what's going on, why they can't see their loved ones, might be incredibly frightened by all the carers wearing masks. It's been an incredibly troubling time for them. We've taken a lot of advice from the Mental Health Trust, Hertfordshire Partnership Foundation Trust, just to help us work with those care homes that have dementia patients. And what we're trying to do is to balance the need for a resident within a care home setting to see their loved ones with the right to safety from all the other residents. And it's a very, very delicate balance. So we take each home on a case-by-case basis. We offer advice and guidance if they're maintaining their infection control procedures, if they haven't got an outbreak, if their staff are well, and they are effectively cohorting patients to limit the risk of exposure, then they can have visitors coming in. However, if there is an outbreak, then there is a restriction. Some care homes have the facility to allow visits in gardens or behind screens. Not all care homes have that. We put in iPads into every care home during phase 1. We were way ahead before the national guidance instructed us to do so. So we can allow some technology. That's been really useful, but I absolutely understand technology isn't going to replace that physical contact, that personal relationship that you strike up with your visitors. We get a lot of challenge. There is an appeals process. If we say to a care home, we think you should pause to visitors, they can challenge back and they say they've got good restrictions, good regime in place. We will review that with health and social care professionals looking at it, and then we'll advise homes. So, but ultimately, it does come down to care homes to decide whether they're going to take that advice or not. But it's an incredibly delicate matter. And just very, very, it's a long answer, apologies. The final thing is, one thing that we have learned in during the first wave is that we should have engaged much more with carers in Herts and those charitable organisations that really support carers. We've had meetings with them now. We're going to do more work with them and try and get that voice into some of the processes and procedures that we've got. But ultimately, as I said, we've got to strike that balance between the right for someone to see their loved one and the right to safety of not getting the virus with other residents. But it is a delicate situation.
Thank you. Thank you very much, Tom. Comprehensive. Yeah. Thank you. Thank you
very much. It's very helpful.
Yeah, thank you. Very comprehensive, the peer review. We go now to Margaret, and I'll just remind you, then Ken, and then Francis. Margaret.
Can you hear me okay?
Yes, we can.
Well, thank you for a very good talk, actually, from Chris and from Tom and yes, I've forgotten the other person, Helen. I wanted to just actually, following exactly on from Sandy's question, and I have the advantage that although I'm subbing for Lynn, I sit on the Health Scrutiny Committee, and carers in Hertfordshire have made a very, very helpful suggestion, I think, that should be implemented nationwide. But to do with visiting people with dementia in care homes, family particularly visiting for mental health and compassion reasons, that one member of the family to be able to go on visiting their loved one could be treated as a key worker, and to give them that status as a key worker for being able to be tested before they visit, and so have a priority to be able to be tested, to be safe, and to be given PPE in the home if there is a risk and if they know there is a case within the home. And I actually thought that was such a good idea. I really just thought for the sake of our dementia patients, that would actually work. And I wanted that to be brought forward, and whether we could suggest it as guidelines within Hertfordshire so that we aren't isolating our dementia patients so much. I also had a very quick question about whether cleaning staff are being tested every week, as well as the care staff in each care home, because they also are at risk and also could carry the virus. And I was also going to make the suggestion, and as Tom said, I actually look after my mother with dementia. She's actually at home in her own home, so I am shielding her. I am a carer as well as being a county councillor, but I know a lot about dementia, and I do think use of transparent masks and making transparent masks available to people that they can buy to be able to visit people with dementia would be really helpful. I mean, it's the same with deaf people being able to lip read, but
yeah, can I just hold you there, because as you know, Margaret, we've got a full agenda ahead of us. You've asked a number of questions. Straight away, the answer has come back to what I picked up as a second potential question, which was regarding testing. And Tom has come back and said all staff are tested each week. Great. So hopefully it satisfied that one. There were two other questions that I potentially picked up. Chris, Tom, how would you like to operate that?
I'll kick off if it's okay, Chair, to answer Margaret's questions, and a couple that I'll leave to Tom. I think on the issue around, firstly, to absolutely agree, the issue around caring and visitors isn't just one around dementia, as Nigel and Margaret have made the point. It's all visitors where this is clearly an issue. I realise there's some specific issues that make it particularly acute with people caring for loved ones with dementia. Yeah, the idea is from Carers and Hearts, and that it's floating around nationally around, in a sense, making a visitor a key worker and providing testing. Yeah, I understand. It's difficult for us to make a local decision on that, particularly because where we commit to, in a sense, expanding the scope of what's deemed a care worker, we still have a very relatively narrow funnel for lab capacity. So
a key worker.
Yes.
As a key worker.
Yeah.
Because they get priority for testing.
Yeah, but that doesn't expand the lab capacity that we've got. That's one of the that's the issue that we have, is that the bottleneck is always the lab capacity rather than the testing. So decisions around what's deemed a key worker tend to be made nationally, but that is something that we're talking quite actively with government on in terms of what that could do, because that could be a way through it, Margaret. I totally accept that. The other issues you would want to bear in mind is not just the PPE, but what an issue that people forget is the training you need around appropriate donning and doffing of PPE is really important. So that would have to be part of the process. Transparent masks, we've managed to we worked really hard to try and get hold of transparent masks. It was a real challenge. Originally, our reason behind trying to get hold of them was, as you said, Margaret, was more for people that were deaf, that needed to be able to do lip reading and so forth and access services that way. We've managed to secure a very small supply, but we understand that as the demand has become apparent for that the supplies for those types of masks will be increasing over the coming weeks. So we'll be keeping an eye on that. We have a relatively small supply for our staff working with colleagues that have got sensory issues, but if there's a specific demand, we may be able to help, but not at a large scale yet, because those supplies aren't there. I've probably forgotten one of your questions, Margaret. Apologies if there's something I haven't picked up.
But there was just one, it's one supplementary, which is really to do with the topic group on care homes, that paragraph 8.3, I'm just hoping we can get a little bit more breakdown of that, because I want to say well done for learning on the job, because I think you have done amazingly well at learning how to, nip CV19 in the bud. But the problem right at the beginning partly was no testing, and partly GPs not being in the loop and misdiagnosing actually at the beginning, so that they called something pneumonia when it wasn't pneumonia, it was CV19. And I have a care home where 8 people died, and you know, I'm heartbroken about it, really, because I don't know that it needed to happen. And it, you know, if we'd had better information right at the beginning. And so I'm very interested in our topic group at the breakdown of, you know, where people really died. And actually, although you say it was transmitted from London, if it had been tested right at the beginning, we might have nipped things in the bud earlier without them having needed to go to hospital.
Well, I think,
yeah, you raise very valuable points, Margaret. But there's unfortunately there's a lot of what ifs in this, and you know we are where we are. Your points about stuff coming forward to the topic group, I'm sure officers at all of the appropriate levels have noted that and will do so. So with your blessing, I will close down your questioning now, and move on to Ken, who's been sitting patiently in the wings. Ken.
Thank you. Just to top up those Sandy's and Margaret's comment, I don't know whether this is a local measure to prevent family care visits or family visits to the family in care homes. My brother's was on Look East a few days ago with exactly the same subject, with his 62-year-old wife in the last throes of her life, not being able to visit. So, you know, with all these temperature testing facilities that we have, this is something that is so critical that we need to look at it and make arrangements to make it happen, because, you know, it isn't the right thing to do to let people die without family contact. It's not right. So I think we've probably debated that long and hard, but my question that I was going to raise separately was, do we have any contact, a regular contact with care homes about their financial viability, because they've had so many added costs and loss of patients in their or residents in their homes? So I wonder what the impact will be post-COVID, particularly on the private sector, and whether or not we're prepared and have an eye open for potential crises of unviable care homes. Just wonder if that's been considered.
Yes, thanks, Ken. I'll come back on that if that's okay, David. Yeah, so Ken, yes, the financial issues is sort of multifaceted. So what we did in Hertfordshire was put in our own support package very quickly. That's then since been supplemented by government support. So where the package breaks down as follows: we have been supporting all care providers with funding their costs around personal protective equipment, which clearly is an extra cost that they've had to bear. So we've been paying that. That's been to the tune of £1.5 to £2 million a month. That's been costing. In addition to that, we agreed at the start of the pandemic in March that we would also fund, subject to the right evidence, costs associated with extra staffing that was required, dealing with things like self-isolation, stopping the moving of staff between care homes and so forth, as well as a commitment during the first wave to underwrite occupancy. So were a care home to fall below a level of occupancy that they were used to in dealing with us and the service users or beds in the sense that we contract with, we would fund it at pre-COVID levels. That funding package has been developed as we've gone on, as money has come from government in the form of the Infection Control Fund, and from last week funding for PPE from government. We got a funding package for care providers now in place until the end of December, and a proposal around Q4, so January to March funding, is currently going through the political process. So yeah, we've funded in the tune of £3 to £4 million a month to extra support to the care sector. That's been extremely welcomed by the Hearts Care Providers Association. We will continue now to monitor care homes' viability, financial viability. We have a process now agreed for how we will deal with requests for support for providers that may be struggling in terms of viability. To be clear, it won't always be possible to support every single care provider in the county. But what clearly we're going to do is make an assessment of what sort of care provider and type of care we're going to be in need of, and look at prioritising that support so far. So far, we haven't had any that have literally sort of fallen over as a result of this. They've remained viable with the support that we've given, but we're keeping a very close eye on that with a number of mechanisms that we have that relate to our care market management responsibilities as laid out in the Care Act.
Excellent. Thank you very much, Tom.
So I just wanted to come very quickly to Ken's initial point around visitors to residents who are in the last throes of their life. There is a caveat within the visitor guidance, both nationally and in the one that Hertfordshire has updated, around if you've got an end-of-life resident or loved one in a care home, there are ways that you can go in and see that person, because it's the right thing to do. There are very clear restrictions in that. You've got to make sure that you've not been unwell or have any symptoms, and you will have to don all appropriate PPE to get in there. But if somebody's end of life, then the care homes will allow those visitors, unless of course they've got a significant outbreak, which is puts them and their staff at risk.
Tom, it occurs that that might well be a document that county members more widely might be keen to be cited on. Is that practical, possible, reasonable, feasible?
I'll be more than happy to share both the national guidance and the guidance that we've developed locally.
I think so. I think every member is very in touch with this particular aspect of the challenges that we've had and we will continue to have. So if it's possible, perhaps that could be sorted out. Thank you very much. I'm going to go now to Francis, who's been equally patient and sitting there in the wings. Francis, are you still there?
Absolutely, yes.
Yes, lovely. Thank you.
I was going to make a quick comment on 7.6 about the opening of the Fairway in my division, which is a residential care home which has been brought back to life. And it showed me how forward-looking our staff are. At the time, massive recruitments to get people in place, bringing lots of our retired staff back. They were really keen to come in and try and help. And a lot of local people were saying, whoa, over capacity, it hasn't been needed, it hasn't been needed. What incredible foresight from our adult care staff, thank you, to make sure plans were in place. It's a particularly good one in my area because of the geography of the building. Downstairs, totally separate from upstairs. It's built on a slope, so it's a separate downstairs entrance, and it has lent itself perfectly to the situations needed for COVID isolation. 2 points have come forward. What I was also going to add, David, you've just picked it up. We all need, and this is nationally, not just in Hertfordshire, more knowledge about the pressures that each care home has. We all know that schools are having to do, each school has to do something differently, but perhaps more publicity on the pressures on care homes where they've got a particularly difficult situation, where there are more cases, or maybe where there are no cases at all. Please publicise that so that we understand where we are and what we can say when we have pressures from visitors. Finance, Ken, I was going to pick that one up as well. Chris, thank you for rapidly coming in and addressing this comment. I'm not going to ask you to look ahead because I don't think any of us can, but I have a feeling now that this is going to last much longer than any of us thought. I have family in Australia. Australia has just said they don't think they're going to be having holiday travel now till the end of 2021 or early 22. Chris, do you want to look ahead in the crystal ball?
Yeah, thanks, Francis. And what we try to do throughout this is obviously we've got a day-to-day operational response that we're managing clearly as a serious incident, and that's not really been stood down at all. In parallel, we're trying to keep ahead in terms of our planning and thinking, so that we think we're now in a position where we're not far off agreeing, for example, the financial support package to the end of March. Significant uncertainty around both demand levels and financial support levels going forward into next year. I think we have to assume that next year costs associated with PPE, staffing, good infection control are going to continue throughout the next year, come what may. Even with a vaccine, those kind of arrangements are going to need to be in place. So we're doing the thinking now that says, okay, where does this leave us in terms of what that support's likely to be like? What are the inflationary pressures on care homes as a result in 21, 22? So I'm confident that 2020, 21 we're clear on the issues. 21, 22. We're looking at getting that work in place. We've done an awful lot of work over the last months. We used, I don't want to say a lull, but when over the summer we had lower rates, lower prevalence, we in a sense got our heads down to do the planning work for 21, 22 then, because we knew that over the winter clearly our eyes will be on an operational response. So we've done that work, and then indeed this morning had conversations with councillors and senior officers around that plan for 21, 22, and then looking beyond 22, 23. Linked to that will be clearly waiting to understand from government where they're going on social care reform more widely, which will have clearly have a financial impact and no doubt change things like our charging regime and so forth.
Thank you very much indeed. Keep going, guys.
Yeah, excellent. Are you
Good
content,
stuff.
Francis? Yeah,
Yeah,
happy with that?
absolutely.
No supplementary. Thank you very much. I'm going to call on Nigel then. Nigel wants to come back in.
Yeah, just a quick one, hopefully, just to Chris on the finance side. We're in broad terms, no need to get into the specific numbers. Where are we in terms of the amount of money we're getting from central government to support your efforts? How much is this eating into your budget and the council's reserves?
Okay, so subsequent to this report, which if you look at 10.1, lists an infection control fund from central government of 9.9 million. Further to that, we've received an additional, I think it's 11.6 that we've written to providers to get out the door to providers yesterday. That's going to care homes, residential care, all care types on a kind of capitated basis, per head basis or per bed basis. So that's going there. So that plus the commitment to pay for PPE means that I wouldn't say I'm not comfortable about it because there's so much uncertainty, but I can see a way through that financial position will be one there that will be there or thereabouts around bringing that in without the recourse to reserves. We're having to manage our day-to-day budget around to support that, and it's a difficult balancing act. I am relatively confident for 2020, 21 in terms of that. And again, I'm trying to keep 6 months ahead of where we need to be to get those plans in place. So that extra money from government was welcome, as was the commitment to fund PPE.
Okay, but just so I'm clear, there's 26 million or so of costs listed in item 10, adding the two together, of which central government has funded the 9.9 million. The rest is coming from our own resources.
Well, they've also given us not ring fence to infection control, also given us that wider COVID-19 grant, Nigel. So yes. Plus, where I've got underspends, where we've not been delivering as much care as we thought we would need to, we would obviously utilise that too. So the significant funds from government on the wider COVID-19, much of that has been directed to adult care as well, particularly around that 6.3 million that you see and 10.2.
Okay, thanks very much.
Yeah, thank you. Chris, Tom, Helen, thank you so much. That's been really, really useful. Everything's contributed massively to my thinking. I'm going to draw the debate to a close now and take you, if I may, to agenda pack page 33, where we have the recommendation at 3.1. I personally think the recommendation needs a little bit of tweaking, because it's the fairly standard that the Overview and Scrutiny Committee considers and notes the contents of this report. I should like to Hello, hello, hello. Here we are. Yes, it's too many buttons, gentlemen, ladies and gentlemen. Right, I wanted to take you to 3.1 on page 33, the overview and scrutiny report recommendations. I should like to add to that, if I may, the comments that I've just put into the chat, which I've lost now. I'm trying to find them. Here we are.
You're back on mute, David.
Yeah, I'm having problems here. Excuse me, it's not working desperately well. Anyway, I should like to add to the recommendation the note that I've just contributed at 10:57, namely it continues with, and the information and comments arising from this debate is /R, contextual, challenging there, is taken into account when considering any future scrutiny work. I think that's important. We've learned a lot this morning. I would like that to be captured and fed into our system and processes. I'm getting agrees coming through. Thank you. Whilst that's going on, thank you so much, everybody, for your patience and pulling your contributions back, despite I know your keenness to add to the debate. We are a little bit over, but we're still broadly on track. So that's down to you. Thank you so much. Are we there, Teresa? It's looking positive. Whilst that's happening, can I thank Chris, Tom and Helen? Most useful. Thank you very much. I've learned a lot. I'm sure members of the committee are very much better equipped now as we go forward. This is going to be with us for some considerable while, and we need every bit of intelligence and sensible knowledge we can. Teresa, are you? Item agreed. Excellent. Thank you very much, colleagues. Right, moving on. We go now to Children's Services, the COVID-19 impacts, and we have Matt Ansell and Joe Fisher. Are you there, Matt and Joe?
Yes. Hi. Good morning.
Good morning. Who's going to lead on this?
We're going to do our usual double act. Do you mind if we
yep.
share a couple of slides? Hopefully you might be able to see them on your screen at the moment.
Yes, you've certainly got emotional and mental health needs.
That's just not the start. That's the start.
There we go. Children's Services is the way forward. Yes.
Okay, Matt's going to start and then I'm going to come in on the SEND response, SEND response.
Thank you.
Matt, are you there?
Sorry, I was on mute. Good morning, everybody. We're just going to run through several slides which link to the report, and then obviously Joe and I are both happy to take any questions. So I'm just going to start with talking about the impact of the pandemic and how we've managed it in the service. And so first of all, this first slide talks about our early help response and our families' first response. And I guess this is a really important area for us to highlight in terms of the sort of the pressure that's been placed on this part of our system, and we can see that demand is going up, and we've already heard from colleagues and adults around the increased demand in domestic abuse referrals. But really, I think the thing that we wanted to really highlight here is that in Hertfordshire we do have a strong early help response, which enables us to support families at that earliest opportunity, which also enables us to stop them coming into often a social care intervention, which is a much more costly intervention for the county council. So having the benefit of a strong early help response is both beneficial for families, but also beneficial for the financial position of the authority. And therefore, we're really keen that we can continue that strong early help response. And we are worried, or we've got concerns about the impact of future demand upon that part of our service. So we've done a great deal of work trying to project what the future demand could look like and how we can strengthen that sort of initial family first response to support families at that earliest possibility. And linked to all of that is obviously one of the things that you're all hearing in the national press is around increased unemployment, which will potentially lead to homelessness, and that's an area that we're focusing on really closely in the department. We're working really closely with colleagues in housing we've got a homelessness prevention team, which is a very small team that comes under, it's sort of a joint team between Joe and I. And that team again is also experiencing pressures, and we're aware of families that have had their intentionally homeless decision held off during the lockdown period, but those families are now coming to the point where they're potentially going to be coming our way and will have an intentionally homeless status. So lots of challenges there, but we'll go on and talk about how we're looking to respond to them. In terms of thinking about social care and the impact of the pandemic upon social care, as we talked about last time, referrals obviously dropped significantly from that sort of March to June period. We saw a slight increase in referrals directly into children's social care in July when some of the schools started going back. But again, as of yet, whilst we're monitoring it almost on a daily basis, referral numbers are slightly up in September now than they were this time last year. So the same data set from this time last year. So we may just be starting to see the beginning of the predicted increase in referrals that we thought we would. And then the other important points to highlight are around some of the operational work and some of the impact of that in our system. So particularly for work that sits in my area of the world, due to lack of availability of courts, our care proceedings work. So that's when we've removed children from their parents' care. We have them in foster care and we're in a court process. A lot of those final hearings have been delayed because the court couldn't hear evidence from a range of different people. And therefore, that's having two impacts. First of all, for children in terms of final decision making, but secondly, in terms of the number of children that are considered as children looked after has increased in Hertfordshire. And that's not necessarily because we're bringing more children into the system, it's because the flow of children out of the system has really slowed down. And so that's, again, something that we're monitoring very carefully and obviously has a direct link to financial implications for us in terms of the number of children looked after that we have at any given time. Thanks, Joe's helpfully moving all the slides on for me. This slide really talks about us wanting to get across the point that for children's social care, the impact of COVID-19 and isn't going to be short term. We know that when families enter into our interventions, that they can last for a significant period of time. And this graph sort of demonstrates that. And what we know is that for those families that end up needing a sort of significant intervention, either under a child protection plan or into care proceedings, that can last anywhere between a year to 2 years. So we've done work about predicting about how much of the work will come into the system and then how long that will potentially be in the system, so we can really understand the impact, both in terms of our finances, but in terms of our capacity to meet that demand and the amount of actual physical workers that we have to do the social work interventions that we need them to do with the families, children and young people. Okay. Thanks, Joe. So I think really importantly is to talk about how we're responding and how we have been responding. So there's been a huge effort by all of the teams and all of the services in children's services, right from the early help teams right the way through to the teams that support care leavers. We've been able to, and we monitor very carefully from March right the way through to now, that we've maintained really high levels of contact with the vulnerable children cohort. So they're children that are either on a child in need plan, a child protection plan, or children looked after, and also our care leaver cohort. And so we've maintained high levels of contact with them right the way through this process. And that was, much of that was virtual, much of that was the use of technology, but also workers were going out when they were really concerned about children and young people and visiting them either on doorsteps or in gardens or in open spaces. So I think the children's services staff have really sort of gone that extra mile to maintain contact and keep children safe, but also keep supporting families during this time of difficulty. And there's some examples there in the slide of how different teams of supported families. The other thing to sort of highlight is that we, at the beginning of all this, back in sort of April time, we developed a set of COVID-19 practice standards for our staff. We review these fortnightly. We base these on what's happening nationally. Myself and others are connected into various Eastern region and national sort of steering groups where we hear and talk with colleagues about what's happening around the country and how other authorities are responding. And we're making sure that our practice standards sort of take all that information on board, reflect what's happening nationally, but also really concentrate on how we in Hertfordshire feel that we need to respond. And so that's given staff a sort of template to work within and how to support families during these times. Thanks, Dave. Again, other examples. So our children looked after cohort, obviously a really important cohort to us. We have about 970 children in care. So it was really important that we maintained really strong links with them, but also made sure that their education needs were being met. And our virtual school has been fantastic during this period. They've really stepped up to the mark. They've been really sort of developed lots of new different ways of reaching out to children, making sure that they were kept in touch with education and making sure that they had opportunities to continue their education. And I think that's been a real success story for us in terms of how the virtual school have responded. The other thing that we are doing and have done is we've have agreement for some additional funds to have a team of workers that we can move around the system where demand is. And so one of the challenges we have both in Hertfordshire but also nationally is a lack of sort of qualified social workers sort of out there to recruit to. So we've developed a team that have some qualified social workers but are also alternative qualified staff. So some really skilled people, some people that have been ex-police officers or probation officers or maybe ex-teachers that are looking to work in this sector. And so we've brought in a team that we're able to now, we're in the process of just training them up, and we'll be moving them across the system, whether that's into our Families First teams or whether they need to come into social care, just depending on where the demand is. So they're a short-term project, as it were, for 6 to 9 months to manage some of this demand, and we think that'll be an effective way of responding. And then we as members will all know, we have a set of sort of performance indicators that we have to report to Ofsted and nationally, and we've obviously had to maintain them during this period of time. And I'm really pleased to say that all of our performance has been maintained to really high standards. And again, I think that's just a complete reflection of the dedication that we have of our staff in children's services. But obviously we're monitoring that, but we haven't seen any dip in any of our performance indicators. And then myself, Joe, Marion and Jenny, we've really kept engagement high. I think with our staff, our managers, we've ran a number of Q&A sessions with staff during this time, sort of getting feedback, understanding what's happening for people on the ground, understanding what it's like for people having to, work so virtually, work in an isolated way, when much of our work is really about relationships and how we build relationships with families. So for staff not being able to come into the offices and be together and share ideas and talk about their interventions has been a real massive culture shift that happened overnight. And so the way people have coped with that again is remarkable. And we're having these regular Q&A sessions to keep in touch with staff and really understand how they're coping and moving forward.
Thanks, Matt. I'll just take over. Before I move on and talk to you all a bit about SEND and our work around children with SEND, just to add very briefly, in terms of children looked after, I do think it's worth noting and celebrating that our children looked after did really well in both their GCSE and A-level results this year. The virtual school worked really hard with schools to make sure their teacher assessed grades reflected their abilities and what they deserved. All of our children got the results that we anticipated, and all of those who did A-levels moved on to the great destinations and got the destinations that they hoped for. So that's just a really good news bit. before I move on. So children with SEND, I've talked to you about this before, and you'll understand now that our focus since schools have gone back in September has really been on making sure that our children, both with education healthcare plans, but also those SEN support children, are back in school. All schools across Hertfordshire report on a daily basis to the Department of Education on numbers who are attending school, including a breakdown of those children with education healthcare plans. A quick caveat is that not all schools are completing that report because of capacity issues, which I'm sure you'll understand, but we are working with those schools individually to help them and facilitate them to make those returns. What I would note is that looking at the data that is submitted, the vast majority of children with education healthcare plans are attending school. And certainly those numbers are broadly comparable with attendance for all children. But we don't just stop there, we're doing much more than that. We have written to all schools in Hertfordshire to ask them to tell us about children with education healthcare plans or those with SEN support where they're concerned about attendance, and that includes both our special schools and ESCs. Those schools are getting in touch with us. They're telling us about individual pupils, and what we do from that is we look at the issues, and then we work hand in hand with the school, but also the parent carers to put in place a support package to get those children back in school. We are having to report to the Department of Education specifically on children with AGPs or aerosol generating procedures. So telling them the numbers of children, the small number of children in Hertfordshire who have AGPs, and also any of those that are not in school. And that's because this has been raised as a national issue, that those children, there might be additional barriers to really include them back in school. And without going into too much medical detail, for that, just to say that the aerosol generating procedure is a medical production of airborne particles or respiratory droplets through things such as suctioning. So you can imagine that that might just need additional risk assessments and infection control measures put in place. We're working really closely with schools. We've worked with one school to convert another classroom so that those children can attend school. So there's a lot of work happening. But we are aware of a handful of children where there have been additional barriers and obstacles to really getting them back full time into education. But most children are attending. And just to flip to this slide very briefly, this is a slide that shows on our local offer the sort of traffic and where parent carers are really looking in terms of our web pages on the local offer. And what we've seen is that most traffic or most website hits on our local offer are for face coverings in relation to SEND, and parent carers can print off the website a pass that says that their child, because of the level of their complexity of needs, do not need to wear a face covering, and that's in line with government guidance. But we can also see that underneath that we've seen an increase in September. This slide might be too small for you to read, but what it shows is that in September we saw an increase in interest and inquiries about if their child is too anxious to go to school, but also in terms of our education psychology service and getting support from them. And the other service that saw an increase was our ESMA service that works with children who have medical conditions to the point at which they might not be able to attend school. So we know there's a huge amount of anxiety out there, which is why we're really keen to put together focused operational delivery and support across education, health and social care. There's a weekly SEND cluster group that brings together key professionals across the system that I chair that is really focused on that and also putting in place recovery plans and responding to any potential second wave as well. We're already in it. Just to highlight a couple of things, we know that in terms of our residential but also community respite, the recovery planning around that has been good, and nearly all of the children are now accessing the respite that they previously did. And on transport, our transport to both mainstream and special schools is running as normal, and we issued operational guidance to our operators that put in place additional safety precautions from enhanced cleaning regimes through to use of masks, hand sanitizers and vehicle ventilation. You know that you'll be aware that the government didn't require bubbles to be replicated across home to school transport, although a number of our special schools, because of the level of complexity of need, did request additional measures. So we've done things like considered additional requests for additional vehicles, but we've also made available funding so that schools could use their own transport where needed, and put in place personal budgets so that where parents want to transport their own child to school, they can. Lastly, I would say that we have, Matt already talked about the additional short-term staffing across early help and social care. That's been replicated across our SEND teams. We can see, and if I just fast forward to another slide, you'll see that we saw an increase in new requests for educational healthcare plans across August and September. In September, it's a 21% increase compared to September of last year. This isn't a surprise. We anticipated this. We know that many parent carers delayed making requests for educational healthcare plans because key healthcare staff had been redeployed under COVID-19 measures. But we also know, anecdotally from our work with parent carer forums, that many parents, in educating their children at home, became very aware of the gap that many of those children face, and will have been now asking for a statutory assessment because of their own concerns about their child's learning. So just coming back to this slide, we work not only across health, social care and education services, but we're also working very closely with our parent carer forums, principally HPCI, so that's Hearts Parent Carer Forum, to make sure that we're communicating through our local offer really clearly with parent carers, families and external stakeholders. The parent carer forums, as well as our experts by experience or young adults who have got disabilities who work with us as part of our team, have been absolutely at the forefront of shaping our communication and making sure that it really targets the concerns that parent carers are telling us about. So our local offer not only has a whole host of teaching and online resources, it has dedicated guidance from our education psychologists on child well-being and transition back into school, and steps that not only schools can take, but that parent carers can take. So there's a lot of support out there, and we've also kept our SEND helpline up and running, that's staffed by education psychologists and specialist advisory teachers. We know that there's been an increase in demand. We know that parent carers and children are facing, unprecedented challenges and levels of need. We anticipate this demand is going to continue to increase. And as I've already said, we're deploying staff into our frontline teams to make sure that we are working together on this. And the final slide we've got is on the financial impact of COVID-19. COVID-19 posed a significant financial risk across all of our children's services budgets, and the latest estimate, as you can see from the slide, is 15.9 million. The key financial pressures are from both the additional cost of children looked after placements. We've analysed that, and we know that it's primarily caused by fewer children leaving care, which Matt has already touched on, or can touch on in more detail, but fewer children being adopted, but also delays in family care proceedings. Additional children's service staff being required to deal with the predicted increase in referrals. That we have anticipated additional cost to home to school transport in light of social distancing requirements. We haven't seen the spike in that particular bullet point that we thought we might do, but we're keeping a watchful eye on that, particularly as we might move into the second wave through the autumn and winter months. And lastly, a significant loss of income from the music service due to closure of schools. So that's all of our slides, Chair, and we've kept it brief because we want to give you the opportunity to ask us questions.
Excellent. Thank you to the pair of you. That's been amazing. Rather more slides than I had anticipated, but I wouldn't have sacrificed any of them. or a word of it. That was really, really, very most helpful. Thank you. This will, I'm sure, raise many questions. It already started with Jonathan Kay. Jonathan, are you there?
Yes, thanks very much indeed, Chairman. I've learned a new phrase this morning, aerosol generating procedures, and perhaps, Chairman, at the end of the meeting you could test us and ask us what exactly that means and see what we remember of that. But my question is simpler in many ways. It's to do with families first, and excuse my ignorance, but it's really just for clarification. When we talk about families first, what are we referring to? Is it a nicer, more modern phrase for what we used to call troubled families? Is it to do with looked after children? Is it to do with early age children? Is it to do with families that have perhaps acute poverty caused by a whole range of things, domestic violence, marriage breakups, and the rest of it? If you could just explain to me what we mean by families first. I know the people who work in that department know it in a heartbeat, but we don't all know that. So if you could just clarify that for me, that would be great. Thank you.
Chair, it's probably best if I pick that one up, as I oversee the Families First. So Families First it doesn't refer to a team. It refers to a whole system across prevention and early intervention. So from our family centres right through to our work with family workers in schools, our intensive family support teams that we run within the council, through to work within our adolescent services, YC Hertfordshire and all the work they do around early intervention. So Families First refers to a whole system of prevention and early intervention. And what we're seeing across that system is this increase in demand. And you're absolutely right, Jonathan, to raise the fact that some of this is to do with the increase we're seeing in poverty, the significant increase in universal credit claims, families falling into worklessness, potential homelessness as they have increased financial difficulties. So on that level, all the work we're doing, both within our families, within our intensive family support teams, but also within our family centres, is absolutely key. At the other end of it, we know that young people are really being impacted on in terms of not having the usual destinations that they might move on into, particularly in terms of employment, apprenticeships and internships. And we're working really hard, both with our local employers and across the sector, to make sure that we can both track what's happening to those young people, but also facilitate and support them into meaningful employment and training.
Thanks very much. Thank you, Chairman.
David, you're on mute.
Yeah, I've got a dodgy connection somewhere. No comments, please. Answers up the back of a £50 note. If you can see me, hear me. Excellent. I'm going to go over now. Yeah, I'm going to go over now to Nigel.
Thanks, Chair. Yeah, I got a couple of questions. One, I think, for Joe, which is on the question of EHCPs and the increase in demand and the progress creating and progressing those. Mark Watkin tells me that these are down 42% on the same time last year. Obviously, it's a massive challenge at the moment, but what is being done to address that? And one for Matt, I think, more is on the pressure that he mentioned due to the courts proceedings taking so much extra time. I don't think many of the population, and I suspect much of the government, is really quite aware of the crisis in the justice system. I mean, anybody who follows That Secret Barrister will know it well, but that's a very small proportion of us. And I don't know what we are doing to lobby government right at the top to address this, because the more one reads about this, the more you just want to throw everything out the window, because it's just frightening how long things are taking now in the justice system and in the family courts, which is obviously what's affecting you guys.
Shall I just first of all pick up on the EHCP? Nigel, I think the 42% that Mark refers to, forgive me, I'm not sure if Mark's on this call. I think probably what we've explained to Mark is that over the summer, while schools were out, there was a dip in requests for EHCPs. Yep. And as I said in my presentation, that's because many parent carers decided not to, and schools were out, but many parent carers also decided not to request the EHCPs because we weren't able to get the right level of speech and language support or therapeutic support into those EHCPs. And we were allowed to do that under the then sort of flexibilities within the SEND legislation. Since August, we've seen that trend reverse. So we saw in August the highest number ever since we started recording of EHCP requests. And in September, we saw that continue. It equates to a 21% increase. So that trend has now reversed. The team are working incredibly hard to make sure that they can address those requests within the timescales that are set. And we are putting in additional practitioners into those teams to facilitate that through our COVID-19 measures. Thank you.
Thanks.
And yeah, I can pick up the question around the court. So yeah, as you say, it's not just our care proceedings, our youth justice work as well, where there's significant delays, and it is having a big impact on us. In terms of what we've been doing locally, myself and the head of legal have been meeting with our lead judge and all the relevant childcare barristers that are involved in CAFCAS. On a fortnightly, but it was weekly, now fortnightly, where we've been using a process of prioritisation of the court work and the cases. So we've been trying to do what we can locally, which has also included supporting a Nightingale court that we've got set up at Robertson's House in Farnham. And then in terms of what we've been doing, so I guess there's 2 or 3 angles to that. It's as Eastern Region cohort colleagues, that we've been raising that because it's obviously an issue across all of the Eastern Region, and we've been raising that, and that's being taken forward by ADCS. And obviously, people know that Jenny Coles, our DCS, is currently the president of ADCS, so we've got a strong voice in that place in terms of the discussions that she's having in relevant sort of national forums. I could get a sort of a more further update I could provide to you after the meeting. I could catch up with Simon Banks from legal, because I'm aware that he's been doing some work as well through his work streams, because obviously it's a national issue and how people are moving it forward.
No, absolutely, and just good luck, and hopefully your voices will be heard.
Yeah, thank you.
No, excellent, very good contributions. Thank you very much. That's most helpful. Margaret, I believe you're next in the frame.
Thank you. Thank you for a very interesting report. I'm interested in denominators, because we've got quite a lot of absolute figures that you've given us, but out of how many, I don't see many, of seeing how many children, for example. I mean, I'm very encouraged by a lot of what you said, especially if we refer to 4.17. Your point about giving out 1,700 laptops. That was going to be my original point, is in COVID, with your virtual school on Saturdays, how many children really had laptops to be able to engage? I can hear that it was being offered from the county council, but particularly parents and children, getting them on board to really be able to use laptops efficiently. And then how many of them really attended? I'd really like to know right up the system for cared for children, foster children, how many of them did engage, and how can we encourage them to go on engaging, and why shouldn't they be really good at IT? But often they didn't have laptops. So often many of these children, the parents, when they foster a child, they're probably not interviewed for how good are they at IT when they first foster children. And so that whole support system, I'd like a bit of feedback on that. And then also on IT, could Jenny Coles actually influence how the court system works to be able to actually do court hearings on Zoom rather than it all being having to attend, because I'm sure that the court system could really get a bit more up to speed like the rest of the world has had to. Thank you. That was my 2 points.
I'm not sure officers can comment on behalf of the Department of Justice, but yeah, I think you're right. I'm aware that video links in courts have been around for 30 years, so it shouldn't be desperately difficult. Matt, over to you.
Yeah, I'll start and Joe may jump in. I'll start with the answer to the court questions that sort of flowed on from the last one. So we have been holding virtual hearings. Apologies if I misled members. So we have a range of different type of court hearings. So when we have had to issue care proceedings, so put the matter in front of the court initially to say to the court we feel we have to remove a child, those hearings are carried on, obviously, because we've needed to ensure that we protect children appropriately. What we haven't been able to do as often is when there's a really complicated case which requires a number of professionals to give evidence on, and including the parents. What the court's position on that has been is that where there's complex proceedings, it's unfair to run those virtually, particularly for the parents. And the judges have wanted to be able to have people, when they're giving live evidence on final hearings, so making big decisions about children's lives, there's the judges talk about the need to sort of have the people there so they can see them. They feel they miss things if it's on video link. So there are a range of complexities. We have been able to conclude some court proceedings where it's not as complicated, but sometimes we may have up to 7 or 8 expert witnesses, plus the social worker, plus the parents giving evidence. And in those scenarios, it becomes very complicated to manage it virtually. And going back to the original part of the question around foster carers and children in foster care. So it's already part of our standards to ensure that any child in a foster placement in a foster care for Hertfordshire has access to a laptop or a computer. So that was already a standard prior to sort of everything that's happened with the pandemic. What we've done is a combination of Hertfordshire providing IT equipment for children, young people and families, plus what the DfE were doing. So the DfE rolled out laptops for a number of children and young people around a particular cohort, and we were able to, I think we had around 1,000 of those laptops, which we got to all our care leavers, certain children in care and certain children with a range of vulnerabilities. But what we also did very early on is recognise that if we had vulnerable children that didn't have access for whatever reason, we needed to provide them with that quickly. So we bought a number of telephones, a number of laptops for children or their parents, so we could maintain contact with them. So I think we've done what, as you know, is really, it's been one of our big focuses, recognising very early on that we were going to have to rely on technology to make sure that we provided those families that we needed to stay in contact with the relevant technology. I don't have in front of me the detail of how many children access those Saturday sessions. I don't know if Joe did.
No, I don't have it in front of me. We could certainly guess it. I mean, what I would add is we do know that actually we've had really good uptake of online learning from our children in care, and in fact, what they're telling us is they like that way of learning too. It helps them engage. So but we can get you that. It's not just the Saturday Club. We've also done some great work for our US children, our children who are asylum seekers, unaccompanied asylum seekers. There's been some great online tuition done for them as well throughout this period. And lastly, over the summer, we were able, with appropriate social distancing and infection control measures in place, to run 2 day schools for our children in care at year 10 and 11. We did that one private school in the west of the borough and also at one of our own settings. Normally we'd run those as residentials. We weren't able to do that, but we were able to run them as day provision, and we had brilliant uptake from that, absolutely full uptake. All of the children attended. I think there was one child who expressed hesitation about attending and then joined in and fully engaged. And some great feedback from them too, in terms of how helpful they found that. And I've already touched on the brilliant results we managed to secure with our children through their hard work at both GCSEs and A-levels.
Excellent, thank you so much. Margaret, we can't hear you. Margaret.
Sorry, I've just realised it went on mute. I'm interested. We often hear the success stories, but it's actually seeing the kids on the edge that aren't engaging, that often do need a little bit more thought as to how to engage them, especially in IT, if they think they're a bit phobic about IT. So I was just interested in the denominators and how we could pick up those children, and if they aren't getting support from parents, for instance, then how do we do something about it? But without the denominators, I can't see what percentage they are really as to what children maybe are missing out, even though I know there are these success stories which do sound really good.
Jo, is that something you can pick up on and send out something through
I can ask
through
about
scrutiny
numbers.
officers?
Yeah, I mean, I can find out how many of our children are attending the Saturday school. What we do know alongside that is children are also now attending school, obviously Monday to Friday, and we've got all of that data too. Our children in care are attending school. The virtual school worked really hard to make sure they're all attending school. We know that most of our children with EHCPs are attending school, and Matt's talked about the fact that social workers work very hard to both track attendance of children on child protection plans and child in need as well, and to work with schools to make sure they're attending. But I can get you the data on the Saturday schools and the attendance there. That's not a problem.
Yeah, since out of the register you've got, you know, how many actually appeared on the Saturday.
Yeah, sure.
That'd be really great. Thank you very much.
Okay, well, it just behoves me now to thank Jo and Matt. I think we've come to the end of the question session. And invite members to go to pack page 43, where we have the same recommendation that we had earlier. And I'm going to make the same suggestion that I made earlier, which is that we include the wording that I've just put up again for ease, and the information and comments arising from the debate taken into account when considering future scrutiny work. Are members content? Would they indicate in the usual way in the chat, please? Thank you, Nigel. Good, they're coming in. Teresa will let us know just as soon as we have a majority or unanimous agreement. Everything's looking unanimous thus far. Excellent. Okay, well, thanks to everybody for this. We're bang on my schedule now, which is a miracle in and of itself. But what I'm going to propose now, right, we've got a unanimous agreement. Thank you very much. So we're closing item 3. And what I'm going to say now is it's 11:40. I'm going to call a timeout until 11:50. So there's now a comfort break until 11:50. Would you please keep your machines online insofar as you can control them, stay connected, and come back at 11:50 for the next item. Thank you. Okay, everybody, welcome back to this meeting of the Overview and Scrutiny Committee. Trust you use the short break wisely. We move now to item 4, the people strategy, and the focus on the impact of coronavirus in that context. And we will take a short report from Sally Hopper. Sally, good morning.
Good morning, Chair. Thank you. So I would like to begin by saying that it would be remiss of me this morning not to pay attention to the immeasurable and sort of unquantifiable effort that the staff of Hertfordshire County Council have put in over the last few months. So I wanted to begin there and to recognise that, and I know members recognise that too. And then, having given that sort of really heartfelt thanks and praise to so many of our colleagues at this time, it's then was my intention to come to Scrutiny Committee at the start of this year with an update on the people strategy and let you know how we're getting along. But then your good selves commissioned that we focus on the response to coronavirus, and I'm going to work on the assumption that you've read the paper, but really bring you up to date to where we are now, because the paper was written towards the end of August, early September, and clearly things have moved on. So on the basis that you've read the paper, the key updates I'd like to give you this morning is that what's changed is that now, of course, when we went into lockdown in March and we opened up the redeployment hub, for example, there was real ability to redeploy some of our displaced staff. But now, of course, many of our services have reopened, and that means that we've had less staff to redeploy. So that's a factor that's changed since the report was written. And we are getting to a stage with a potential second wave where we're working hard to think through, if we do have a reduction in the workforce, what services will it be absolutely imperative to prioritise? So that work is going on in the background to give us that sense of prioritisation. The other thing that is, of course, on all of our minds at the moment is that the statistics for potential second wave and where will that leave us and what response we need to prepare for that. And that's going on all of the time in terms of what we need to pay attention to, so we're best placed to respond with the circumstances we find ourselves in. And one of the considerations of that second wave is also staff, very much of having sort of started my presentation with commending staff. It's also not lost on the senior management team and our unions that the staff are feeling tired, and also there are some morale issues that we need to pay attention to. So making sure that staff still feel a sense of belonging when they're often maybe working remotely, or alternatively working in very difficult circumstances on the front line. So how do we do that? And in the paper, you'll see that I give a whole section over to rewards and recognition, and also to well-being. And that's where we really do try and continue to pay attention to those two really important issues. And I think if I had to summarise it, it's giving messages of reassurance and regular praise and thanks, and also doing our very best to give staff clarity where we can. So if our sort of rule of thumb since we started our response to COVID-19 is where we can give clarity in these very uncertain times, we will give clarity, and that helps staff overall, hopefully. And we've had some really great praise in our comms and the way we've communicated with staff. So they've been incredibly grateful for that at this uncertain time. And then the other factor that the team have really had to pay attention to is, although we are obviously a public sector body, we do have some traded services, and specifically we've got Hearts Catering Limited, which we provide HR support to, and they of course furloughed 1,400 of their staff. So it's just really bringing the committee's attention to that scheme does end at the end of October, and it's replaced by the job support scheme, the JSS scheme. So we're just currently working our way through that. I won't go into the detail now, but it's just to give members reassurance that we are paying attention to that as well. And then I think the final thing that we're also grappling with is, whilst we were absolutely delighted that schools reopened in September, and there was an enormous effort to make that so, and lots of support all round to make that happen, what it has done is it has given some uncertainty to our parents and carers, and of course some of our other community members in terms of children having to be sent home where there is a concern. So this has led to another area where we've had to support staff and try our best to do so. But it is definitely another factor that's different when everything was locked down from March. So there's another update in terms of my report this morning. And I think the final thing I'd really like to end with is we continue to think through what are the key like how our staff, we've been doing pulse surveys to check how staff are, and generally those have been favourable. And we've also done lots of, like for example, yesterday we had the leadership forum, and there were some key questions came across there, and it gives leaders a chance to engage and hear the latest updates on thinking and plans. And we're also doing lots of trying to encourage managers to do sort of team events, you know, where they can get together virtually and perhaps have some time together to support each other. So we are looking at all of this and continue to look at it. And we also continue to look at how will we work going forward, and something that we have regular meetings in the form of shaping our future. So that is being headed up by my colleague Anna Morrison. But that is really looking at how will we work in the future, and that's something that I know is a sort of national, if not international, debate going on at the moment, and happy to say more about that if that's helpful. But they're the key things I was going to update members on in terms of the report and how it's developed since it was written, and now I'm very happy to take any questions.
Thank you very much, Sally. If I may, I'm going to use my position as chairman to ask a few questions. The first is around professional training. Are we able to support our staff through ongoing professional training, which could easily be a lower priority under the circumstances and with so many things to do? You know, have the professions that people are taking qualifications in, have they slowed things down? Are they embracing the new digital reality, the new online training? Are we able to support our staff so that they don't have a however long gap in their progression as we go forward? That's the first question. The second question is right at the tail end, you're talking about a sum of money for the expression you use is recognition. That seems to my mind to be extraordinarily modest. So congratulations if that's where you want it to be, but you know, is it enough with our current headcount and with the hard work that they're doing? You know, I think we can't offer them everything, but recognition is something, and that comes to, you know, pennies per headcount basically. That comes to £1 or £2 per FTE. So just two questions there to get the ball rolling. Thank you.
Thank you. So in response to the first question, I'm very happy to say that we rely heavily on our partnership working with the universities and learning providers across the county. And we've had a really good dialogue with them in response to COVID. And they have been brilliant at transferring much of their learning to virtual solutions. Then when it comes to our many colleagues who are doing either an apprenticeship or maybe some self-learning or maybe a formal training course that they would do to keep up to date with their profession, much of that has gone virtually very successfully, and we've had some good feedback on that. We also, though it would be important for me to bring to members' attention, have had some delegates who have formally asked, please may they delay. This could be due to work pressures or other priorities in their life at this time. So we have had, I don't have an exact percentage, but we definitely do have some of our colleagues who have been learning either put their studies on hold or ask for a formal postponement. So that is something that we're supporting colleagues with. But overall, my team have been looking, we've put a whole COVID-19 learning and development platform on the intranet as well, which I know colleagues have found very helpful. So I think overall it's going as well as can be expected in very tricky circumstances. And then when we come to the subject of recognition, you know, I don't think I could, you know, we could ever say thank you, really. It feels such an amazing effort in so many different ways, you know, so many diverse ways that people have absolutely gone beyond words, you know, sort of can't find the words really to say it, but they really have. And we see examples of that all the time through staff comms and sharing positive messages. What we're also mindful of, though, certainly for me, if I speak for myself as the person who heads up our HR policies and practices, I keep in very close contact with the LEP and other community members. And it's definitely not lost on me that many members of our community are facing job uncertainty at this time. And I know at one point during the COVID-19 response, we had over 90,000 people furloughed in Hertfordshire. And also that job insecurity is something that many of our staff are experiencing in their own families. So we've been very sensitive to that. So what we have been able to do in the county council is being able to give as best as we can at this very uncertain time is largely pay security. And the unions get that, by the way, they understand that. And so therefore that leans us towards those recommendations, which are fairly modest when it comes to recognition, things like certificates, pin badges, thank you sort of road shows, virtual road shows, and the possibility of an extra day's leave still to be discussed and considered. But it is fairly modest. But I think we're also trying to be proportionate and realistic with the external economy at this time.
Excellent. Thank you very much. Exactly what I had anticipated. We've got a question from Jonathan.
Thank you very much indeed. Sally, I think what you said about a sense of belonging is probably really important, because I think even some of us as councillors can feel a little bit disconnected during, this period. Because we're not meeting with one another. And you must have taken on staff who have only been taken on since the lockdown began and who have never really met most of their colleagues or only occasionally go into County Hall or wherever. And that other aspect of working in a team, which isn't just to do with work, but to do with, the psychology of mingling with others and the social aspect of it, that's not there. So do you have to work particularly hard when you've actually taken on people since March who really don't know the layout of the building, don't know who to go to, and that sort of thing?
Yeah, so it's a really important point, isn't it? And I think that the interview process has moved virtually very successfully, and we have done some training to help managers with that. But then paying attention to our new recruits, we have, when we've done their induction, physically come into a county office and physically met with the individual, maybe handed over some key equipment, some key messages, key induction face to face. So we have, wherever possible, done that. For example, we were very proud to keep our graduate scheme still going, and we welcomed several new graduates in September, and we did much of that face to face. So we are still doing what we can to make people feel that sort of human interaction and that social welcome. Then when it comes to them then going off to their workplace in their remote location at home or wherever they're living, we have had to work extremely hard to really keep that momentum going and making sure that they're getting clarification in a different way, and perhaps a less easy way, because we all know that when we work in the office environment, you pick up things, don't you? You overhear things, and that helps with your learning. And of course, we haven't had that privilege, but it's largely gone very okay. We've had some really nice gestures as well. So I know our Director of Resources, Scott Crudgington, made a special welcome in his newsletter to new recruits, and I know other chief officers are doing the same. And I think that's a really nice gesture in the circumstances we find ourselves, to make people feel that special, warm welcome. And that's something I know we'll continue to pay attention to.
Thanks very much.
Thank you, Sally. My apologies to Sandy, because I called John out of order. John, thanks for that. Sandy, apologies. The floor is yours.
No worries. No, that's absolutely fine. First of all, a really interesting report, and I particularly liked the Trust in You theme round helping employees balance their caring responsibilities with their employee responsibilities. Very, very good message to be sharing. I am just fascinated what happens in the future, because one day COVID will end, inshallah, but we're not going to go back to how it was. And I'm really interested in the work that you might be doing as to, clearly it'll be a mix of home working and coming into the office, and it's easier for people who have their own study at home rather than somebody who's balancing their laptop on a kitchen table with crying children behind them. So one needs to sort of balance that up. But it does seem to me, looking at my own children and how they are working in their various careers. Well, my daughter's a teacher, so she fundamentally is back in the classroom. But actually, for the other two, it is deeply interesting, and for me, fascinating as someone that worked all my life to see what a profound change has happened. It's not going to go back to how it was in terms of office demands and all the rest of it.
So thank you very much for mentioning the trust in you. It served us extremely well, and it has received recognition. For example, we received recognition in the MJ for the approach we'd taken early on with the trust in you sort of approach. It was absolutely the right thing to do. It's been empowering and enabling to our staff at a very tricky time. And I think in terms of pre-COVID, these conversations were going on. So it's been a real team effort, and the conversations that were going on pre-COVID were around about having more smart working, having a greener way of going on, so less mileage. Also, very much how can we make best use of our estate? So those conversations were very much happening pre-COVID. And the way I describe it is that COVID has absolutely accelerated those discussions and brought them forward. And in terms of what will be the future of work? As I said earlier, there is that national and indeed international debate going on, but bringing it locally to Hertfordshire, Scott Crudgington, as our Director of Resources, is heading up Shaping Our Future. And that's really thinking through how is the best way to serve our members and to serve our citizens and our staff, and what is the best way to do that faced with what we've learned from COVID. What do we want to keep? And what do we want to abandon? What do we want to stop doing that doesn't work so well for us? So there's a whole great bunch of people within the County Council thinking that through at the moment. We're very privileged to have some real experts thinking that through. And I'm very confident that it will come to hopefully a good way of working, an improved way of working, and it will mean that most likely, who can be sure, but I imagine most likely it will mean that we come together for collaboration and for meetings, and where one is just perhaps writing a report or doing some budget work or doing some research, they'll most likely work from home or from a remote location. So that's what I imagine. And I suppose the key message is we don't want to just snap back to where we were before, because there are some really good things that have come out of this, and for the reasons I sort of started with. So it's very exciting and something to think about for sure.
Thank you very much for that. Sandy, any secondary on there?
No, not at all. Just a very quick comment. My son just spent 6 weeks in Poland, and it wasn't holiday. He was able to do his job working for his London employer perfectly happily from Poland. All the staff have been sent home, and where home is doesn't matter, providing there's broadband. This is just transformational. It really is.
Absolutely.
And there are some jobs that clearly are customer facing that won't change, but others, the whole world is, up in the air.
Yeah, and of course, and the widget makers, of course, need to stand in front of the machine that makes the widgets. So, not the entire population can't join and be in the flexibility that we have. But Sally, before I call Margaret, could I just raise another couple of points? I entirely associate myself with the comments that Sandy made around the trust, and you introduced the word empowerment, I think, and I'm a huge fan of that. Having employed people over many, many years, the value of that at the right place at the right time is incalculable. It's and the biggest asset we have got is, in fact, obviously our staff and those that work with us and for us. But I've spent virtually all the time I've been in local government trying to recognise where silos exist and trying desperately to batter them down. But it strikes me that the situation we're in at the moment would frustrate that process. I think under the circumstances we're working in now, there's more of a likelihood of silos being reinforced or even developing afresh. Are we focused on that? Is that part of our thinking?
So we very much so, because there's been a very important opportunity not to be missed this morning in my update to members, which is that during COVID, because we had to respond in such a fast-paced manner, it brought together teams, and I've worked with people in the last few months that I wouldn't necessarily have worked with, and I'm not on my own in saying that. So that's been a wonderful opportunity to ignore the silos, ignore which department you work in, and absolutely come together in the best interest and outcome based. And when I speak to staff and I say, what's your reflections? What common reflection that comes through is they really like that. They really like that, just coming together to solve the outcomes and perhaps being less formal and less structured. So that's definitely something to keep as we go forward. I think the other opportunity is just by coincidence. So pre-COVID, we were heading up leadership training called Supporting Leaders Through Change, because we were mindful we've got a lot of change going on, and that's bringing them closer together as well. So I'm hoping, for a couple of reasons, that there's lots of positives to celebrate from COVID, in so much as it's brought our colleagues closer together to find solutions, and it has formed a number of new relationships. And because the colleagues were coming together to solve some really tricky, really complex problems, they're really quite relationships that I like to think will now run deep and be long-lasting relationships that will serve us well to, if anything, break down the silos even more before COVID.
Thank you very much for that. Are we in a position to capture these lessons? It's all so new, it's all so fresh, it's all happening so quickly.
Yeah.
We're all focused on so many different aspects and doing it all at a rush, but is somebody able to step back and capture some of these lessons so we don't lose them in the fullness of time?
I think very much so, and we're getting the feedback very informally sometimes at meetings, but on a more formal footing. I know within resources, the Resources Management Board, we're very much paying attention to these new ways of working and how they can influence and shape how we sort of interact and get outcomes in the future. So very much it is being captured. Thank you.
Okay, thank you for that. I've got Margaret next, but Nigel says he has a comment. So is it about this? Is it pertinent now, Nigel, or could you slip in after Margaret?
Well, it is pertinent, so I'll just be brief. I just wanted to echo what you've just said and what Sandy said before. I mean, I'm just really heartened by what I'm reading here, and also a lot of the other communications that I've seen coming out to staff through this. I just think it's first class, and I think the fact that you are thinking about those strategic issues is just so important that we do capture as much of this. And I was going to comment on the adult care section earlier. I mean, there are a couple of there was some really encouraging joint working going on now. I mean, the one I was going to lift out of that was the money advice unit linking up with Citizens Advice, and good things that have happened that probably should have been happening anyway but hadn't. But this crisis had caused us to think outside the box and make them happen. And I just think that's been so good to see. I mean, that was all I wanted to say.
All right, thank you for that, Margaret. Thank you. The committee appreciates your patience. Thank you so much. I'm trampling all over your time, but please crack on.
That's okay. I really welcome this report, and I want to say thank you very much, Sally, for being the person you are, for writing it. Actually, I'm really pleased to see the appreciation of staff. It's been so difficult in COVID, but I think Hearts has done really, really well. And so I really welcome this report. I had a very practical suggestion, which I've just put in the chat, which is about whether we can save a bit of money with PPE by thinking about recycling, particularly masks, and thinking when people really have their own individual PPE in non-risk, so they have to wear PPE, but actually it's their own individual PPE and it can be recycled. That was my first little comment, to just try and save the planet a bit, because we do have an enormous amount of plastic, unfortunately, being generated. I sort of mentioned it for adult care, but it was only in the chat. And I just thought that's a little thing to say, a little bit of guidance as to the different circumstances when people are using PPE to save us perhaps money and the planet. That was one little practical thing. And I was just going to say, in reflection, I actually would endorse giving staff a day off. I think that would be a brilliant idea, to say thank you to them for all the extra time I know that they have been putting in. And you know, I would endorse that. If I don't know if we're going to vote on it, but that would seem a very appropriate way to say thank you in a real term. And I think all the badges and the other thank yous is also really great idea. I was going to say in all the Zoom meetings, and obviously, as you've said, we've been thinking about flexible working, and I think it's great. You're right that it has, the whole of COVID in a way has empowered staff, and the Trust in You policy has been great for helping people to feel esteemed themselves, and we do really appreciate them. Some staff who are less extrovert may not be telling you what might be happening with a bit of isolation for them, without, you know, how do you do a sort of monthly feedback to say when would a face-to-face meeting really be useful, necessary, or if they aren't a manager, how can they put in their spoke to help it be organised? Because I am aware mental health wise there can be isolation that you might not be aware of, and they may not be wanting to tell you much about it. But actually we should be able to pick up for the well-being of staff.
So thank you. Yes, so if I may, I'll bring the recycling concern, which is a concern I'll also echo to our sustainability Julie Grieve. So I'll take that out of the meeting if I may, and I will absolutely say that members have given that feedback. Anything we can do to have recyclable PPE, noting the restrictions around that for health and safety reasons, but if there is anything more can be done, or at least to be making sure that when it's disposed of, it is, if possible, recycled, then I'll absolutely bring that to their attention outside of this meeting. And then in terms of the day off, thank you very much for your response to that. That's helpful to know. And the due process that I'm going through is I'm going to take this to the Senior Management Board on Monday as a suggestion for their consideration, and taking all their viewpoints of their various services and how it might work for them. And then if they are minded to agree to that, then it will be going before the Employment Committee. So just to let everybody know what the governance is surrounding that. So that's my next steps with that. And then when it comes to staff feeling isolated, this is very, very hard, because I think if everybody has shared so many stories, people have lost loved ones throughout this, people have had to cope with so much, grappling with so many different things all at once. Everybody's got their own lived experience. And to that end, we have had very Caroline Butler is on the line, who works in my team, and she's led on mental health. And she has done a sterling effort at really working with the NHS on what is our response to mental health and what might we do. And I think a few people pulled me up and said, you know, it goes beyond just saying we've got an employee assistance programme, of course, which we have and we're very proud of, but we need to do more. And to that end, we have very much started a conversation, and it was kept going in National Inclusion Week just last week, whereby we had a number of staff sharing their personal mental health reflections. And why did we do that? Why was that important? Because what we're trying to do is, even if you are introverted, we're trying to say to people it's okay to talk about this. Now, when I came to the County Council 4 years ago, it was less out there, it was less of a conversation, and I take no sort of claim for making it more of a conversation, but all I would say is we're much better now in today's world at saying to people it's okay to bring your whole self to work and to speak about how you're feeling, and, you know, get help. We're here to help you, and we've done lots to publicise that. But I'm also very mindful that what I'm sensing is colleagues aren't just coping with their own personal set of circumstances and mental health. They're also having to support loved ones, maybe as a carer, maybe their young person is facing job uncertainty, and or maybe they've got their own mental health concerns at this time. So it is a broad context of which we're trying to help people, and I think that's why some of the things I've referred to earlier in this meeting about giving clarity when we can has become all the more important, because where we've been able to help staff, that's helped. That can only be a good thing for their own overall mental health, but something that we'll keep a very close eye on. And just to end on that very important point, Caroline very early on recognised that we could be facing, according to Mind statistics, Mind the charity, 4% of the workforce possibly experiencing post-traumatic stress disorder. So I was therefore very pleased when we went to the recovery group and asked for funding. We have got permission for some funding if we need to call on it for post-traumatic stress disorder. So we're very much envisaging this will be for the minority of the workforce, but we can't rule it out for some of our staff who have had to face some particularly difficult situations in the past few months.
Thank you. That's very helpful, Sally.
Yes, Sally, thank you. Most informative. Can I just draw members' attention to Tom Hennessy's comments in the chat? And that really gives me the opportunity just to flag up to members if they've got any questions around the caring side of provision. Tom is still with us and able to take those calls. I'm not suggesting we do, but if any members have got that now is the time to bring those forward. Give you a few minutes to reflect on that. No, okay, thank you very much. Well, in that case, it remains for me to thank Sally and Tom, who's been hanging in there to assist where needed, for a fulsome report and a very comprehensive addition to that. We fully appreciate that your role is constantly evolving, and we wish you luck with it, because it's pivotal. So thanks for that. Can I take members then to agenda pack page 53, where we've got the recommendation at 3.1. Again, I personally feel that could benefit from the addition that I've just put into the chat, not dissimilar to much the same flavour as we had earlier. So any comments on that would be appreciated, failing which, would you please indicate your agreement? Thank you. Whilst that's coming through, can I just thank the presenting officers for their input today. It's been very, very stimulating as far as I'm concerned, and clearly from the questioning that's shared with you as well. So I'd very much like to thank them. The next item we go into is item 5, the Scrutiny Work Programme, which does not require direct input from them. So given that I appreciate fully that they've got many other calls upon their time, if they wish at this stage to retire from the meeting, I think that would be perfectly acceptable. So just as they go, my thanks ringing in their ears. Do we have, Teresa, do we have consensus on that? It looks like it to me. I just need your formal acknowledgement. Thank you. Excellent. Good. Well, thank you, colleagues. I'll take you on now to item 5. All being well, this is something that we've discussed before. I don't think there's any surprises in here. So I'll ask Fiona to introduce it and take us through it. But my anticipation is that this shouldn't be a frightfully long piece of work. Fiona, over to you.
Thank you, David. So this committee, along with the Health Scrutiny Committee, you took evidence and deliberated over this work programme throughout July, in your meetings in July and August, in light of the pandemic, and you prioritised the items for the work programme that you thought were the most important at the moment, and you felt would give the most impact for your citizens. So, you know, with that in mind, that work programme that you've got in front of you is the refreshed work programme, very much in the current COVID context, which we know, and as we are hearing, is changing all the time. So that's for you to consider as usual, and we'll take any comments, any suggestions, proposals now, but also we've got to bear in mind that we're trying to kind of do as much work as we want you to be able to do as much scrutiny work as you can to kind of catch up on time where we didn't have any meetings, and we have to always think about prioritising. So if we want something new on the programme, we've got to think about pushing something back a bit further, that sort of thing, which is why in this work programme this report I included the section just outlining the different methods we've got of scrutiny. So this is always worth considering. So we've got bulletins, which are shorter and take less time to kind of prepare and get out, seminars, which we've had 2 done online webinars in August and September, which I think the feedback's been really positive, so we do want to use that format as well in future. Site visits, which at the moment are on hold, and they're more health scrutiny committee territory more often, but we are looking at ways that you can do site visits like in a virtual way, and obviously topic groups, which are most in-depth, fully detailed, where we'll come up with recommendations from those. And the other thing to add is that obviously when we were looking at the work programme as a joint committee, we were looking at everything for scrutiny, and now I've included the remit of OSC, because now you're meeting again as an OSC committee. You're just looking at the OSC remit of scrutiny. So included in the report, you have got the outline of all the work programme, the topic groups, seminars, bulletins and committee meetings, but you also have, quite importantly, 2 draft scoping documents to consider, and they're 2 scoping documents that we're trying to get off the ground pretty quickly, quicker than probably our usual timeframes. So any comments on those will be very welcome. So that's the Hertfordshire Safeguarding Adults Board, which is a statutory annual scrutiny, but also was felt to be particularly important given the background of the pandemic, and the COVID step back review topic group. So with both of those, I think it's going to be quite important to look in the constraints section, so you can see, especially with the COVID step back one, because we are looking at lots of areas related to COVID reviewing throughout all of our scrutiny work, which we've already started, including at committee today. So I think it's just worth looking at that and fully understanding that we have to kind of make it doable and achievable within a topic group, a one-day topic group. So that's probably the main thing I want to say, and just comments and questions, and also to make sure that when going through the recommendations, we clearly are able to hopefully confirm if you're happy with those draft scopes, so that we can move on and get them off the ground. Thank you.
Thank you very much, Fiona. Helpful. Nigel, I think you're first in the ring with this one.
Thanks, David. Yeah, a couple of things. First of all, I've had a suggestion from a colleague to add something to, I know what is already a crowded list of programme for the next year or so, but it could be something that's covered with a bulletin, I believe, and that's to look at the current waste management strategy in the light of the decision on Ratty's Lane. I know work is ongoing on this, but I think members across the county might want an update on we need to be looking at where that is going, because it's quite a significant change of direction. The other thing I want to...
Can I just, while you're there, I would support a bulletin, certainly. I think information is important, but not necessarily before Christmas. Everybody's very busy, but I would certainly support that.
Right, and then I'm a little bit concerned with the scope for the step back review. I do think it's a little bit too narrow. I would question whether maybe we ought to be looking at a 2-day topic group. Although I recognise that we are covering a lot of things in different topic groups and seminars, I think the point of the step back review was very much the overview, and to get the experience of the public as much as possible into the mix. If I go back to the webinar that Natalie and I attended from CFPS, sort of the key things that were in that were reflecting on the experience of council action and the community impact. I'm not sure what we've got in the scope at the moment quite gets to that. The list of things that they suggested we should be looking at, what have been the successes of council action? Well, I think those are included in there. How have partners worked together? That's something I really do think we do need to highlight, and as we've already covered in a couple of the items already today. Who has been worst affected and why? I think that's a really key question that we ought to be thinking about as part of that review, and talking and getting input from more community groups, whether it's the mutual aid groups or however we do it. But I think we need to think harder about getting that input from the community, not just from our own internal resources. And I think a key one, particularly now, is how was the initial crisis period handled, and what was the impact on decision-making arrangements? It was a massive panic, and I think the council has done incredibly well. But I do think that we do need to look back at some of those early parts to just learn lessons where we can, because some things went very well, but some things didn't. We need to hold our hands up and learn from that if we can. That's all.
Yeah, Nigel, I think everybody would agree with you, but my basic instinct, which has been reinforced over many years by hard-won learning, is that with scrutiny you focus and then you focus again and you tighten the focus until it squeaks, because otherwise you end up disappearing off into all different directions, which don't often generate anything that's profitable. So I entirely support the concept. If we're going into a 2-day, and if broadly we think that's where it needs to go, then I think we need to look at it and possibly split it up rather than have a 2-day on one thing. But this is a conversation I'd be very happy, and I know officers would be, to have with you, and see if we can't bring this back. We can't keep moving it, unfortunately, because otherwise we'll never. It's if you wait, it's the old story of the RAF and their radar for the Nimrod. The aircraft was sitting around for 24 years, and they kept changing the spec for the radar, and they never ever got to it because they were looking for perfection. And so we never got it. But I entirely grasp the desire and the concept. I think we've got some work to do offline to bring back to members on that one. Yep. Okay, thank you.
I'll happily put some suggestions into Natalie and yourself.
Yes, please. And I must confess a certain nervousness around the bringing the public into it. I entirely agree. I have a certain nervousness of how we could effectively and best do that to get a good result. Indeed. But we need to go down that road. We need to have that conversation, and I'll happily sit down with you and Lynn and the officers and go through it.
Totally appreciate that, David. Thank you.
Margaret, I have you. The floor is yours.
Yes, I was just going to sort of follow on from that I agree with Nigel about asking the question, who was worst affected? It's not necessarily easy to find that answer out, though, and we need to think about what data we would have access to. I mean, obviously, well, I used to be head of public health intelligence. I'm very aware of trying to find population health overviews and population employment overviews. Census 2021 is meant to be happening next year. I'm not sure what will happen in COVID. We have. I'd like to know what information we've really got that actually tackles the whole population, to really think, how do we find out who was worst affected? I think care homes and relatives of people in care homes is a very good way of doing it, but I don't know whether we've actually got a survey that could actually pick that up. but I think we need to just think about our methods to make this as meaningful as possible.
Excellent. Thank you very much for that. Noted. I'm looking around. I can't see any indication that anybody else wishes to pose a question or comment. So can I take it that we are broadly content and take you back to the recommendations on pack page 64? There are 1, 2, 3, 4, 5, 6, 5 of them. 6 of them. Could I ask that we accept them en bloc, seeing as we've not raised any questions? Can we take those all en bloc?
David, I'm not sure I'm happy to approve the scope of the step back review at this point.
What would you propose we do with it, Nigel? How do you propose we deal with it? We're not going to be meeting again until the 11th of December.
Yeah, very good point.
Something is better than nothing in my view.
Subject to some tweaking, could we say?
Yeah, but that's difficult to record in a minute. I entirely endorse the goodness me, I've been there many times. I entirely endorse the gesture. I think officers need the certainty of getting something moving.
Yeah.
And yes, we can tweak it. I mean, obviously that's what we do. We tweak, and we acknowledge, and we. So, Margaret, you're waving at me.
I think very similar to the previous items on the agenda, when you've said instead of just noting the report, you could say the scoping documents attached, subject to the comments made at this meeting, be approved, so that we actually do take into account Nigel's comments and my comments, so that the scoping, these 2 scoping documents that aren't really quite finished yet, could at least incorporate what we've said today.
Again, I have some sympathy for that, but it doesn't mesh very well with what we've got. I'm going to take 2 minutes out. Officers are engaged. Let's see. They're better at putting these things together, so we arrive at a situation we all recognise, understand, and work with. So let's give them a few minutes just to reflect on that, see if they've got any suggestions to come back, because we don't actually have a noted, Margaret. There is 3.3, but apart from that, you know, they are specific recommendations about specific elements of work, and I'm very keen, and I know that colleagues are, that we give the officers the certainty to go forward with a work programme that they can engage with. Otherwise, we lose valuable time. Any input from Fiona or Natalie here? Okay, so if you will agree those scopes on the basis of, they will reflect and note. Sorry, they will note and reflect the comments of members made in this agenda item 5. Does that meet with your support, Nigel?
Yes, that's fine, and I will send a more detailed email to Natalie and Fiona and yourself.
Yes, please. Yes, and Lynn.
As soon as I can.
Yeah.
Okay.
Yeah, bring us into the conversation. So, would you then, on that basis, members, would you agree?
Yeah. Okay.
While we're doing that, I'll just point out that, that there is no other Part 1 business. We have no Part 2 business. The next meeting will be on Friday, the 11th of December at 10 a.m. We've got item 7, agree items for inclusion in the committee's report to County Council. Are you going to talk to that, Fiona, or is that basically business done?
No, I wasn't going to add anything on that. The only thing that's probably worth mentioning is the scrutiny, health and social care scrutiny training that we've commissioned Centre for Governance and Scrutiny, they're called now, to deliver on Tuesday for all HSC and OSC members. Just a reminder.
Yes, thank you. That was over the page and I was getting to it slowly, but just don't forget, at Friday the 11th is members is very significant. I was tempted to say important. All the work we do is important, but it is significant because, of course, we will hear from the Regional Schools Commissioner and a senior Ofsted inspector. So this is our opportunity on behalf of our residents and our fellow members to really drill down on this. So I hope everybody will be there to work through this particular piece of business, which I think will be not only most interesting but most informative. Well, on that basis, I thank you. I thank you as members of the committee for your help today getting through. This is a full agenda, and you've helped me enormously. Once again, the presenting officers who have now departed, but they did superbly well. Can I again mention our democratic services officers who we don't see, we don't hear from. They're in the background, but they have worked extremely hard to make this meeting happen, and they've worked extremely hard during the course of the meeting to support us. So my thanks, and hopefully your thanks to them, and of course not forgetting our very own scrutiny officers, without whom we just couldn't function at this level. And I think we do function at a very high level, and there are others, our peers think we function at a high level as well. So that's most encouraging. So once again, thank you all. At 12:40, I'm closing the meeting. Many thanks.